A new health alert out of Bay State Medical Center reveals that dozens of children are testing positive for RSV.
The respiratory virus can be extremely dangerous, especially for infants and toddlers, so detecting the virus is crucial. Western Mass News reporter Alyssa McCann spoke with a local doctor about the virus.
So right now we're starting to see RSV in our community now. There's positive swabs in the emergency rooms and doctors' offices. So okay, it's here. It's a little early.
RSV, respiratory syncytial virus, is on the rise in Western Mass, and the numbers are shocking. According to Bay State Medical Center, over the past month, 90 children have tested positive for RSV, and 40 kids alone in the last 7 days. Several of those children were admitted to Bay State Children's Hospital.
Incredibly contagious. And the populations that are at greatest risk are children under age 2, children have special needs, like have cardiac problems, or the Downs population, babies born prematurely, and then also the elderly. It will go through nursing homes.
Dr. Paul Salva, a pediatric pulmonologist, tells Western Mass News RSV can be very dangerous, but it's also common.
It's unavoidable. Everybody, by age 3, everybody on Earth has had it at least once. It comes in the winter months, so in the northern hemisphere, it's our classic time.
Dr. Salva says the virus gets worse and the risk factors increase for children with Down syndrome and premature babies.
The most common major risk factor, there's 2, actually, male gender. Boys are far more at risk for having complications, having a complicated RSV than girls are. And also, if the most common other is if they have asthma. There's an underlying asthmatic picture.
So what are the symptoms to look for in your child?
Symptoms are, it typically starts with a runny nose. And the vast majority of people, it's just that, it's a cold. When the little guys get it, it's a little runny nose, and then a percentage of it rapidly progresses to their chest with cough, congestion, pulling at the nape of the neck, ribs pulling, things of that nature. Obviously, given that, they'll go, their feeding, their ability to eat and drink will drop off.
Since the symptoms are so close to a common cold, Dr. Salva says it makes it even more difficult to diagnose RSV.
Bronchiolitis there's 6 or 7 viruses that give the exact same symptoms. RSV makes up 60% of the total, though.
Health officials are also reminding parents there is no cure. You just have to let the virus run its course. But also keep in mind RSV could be a gateway to asthma.
And very, very commonly, RSV is the revealer that the child has an underlying asthmatic process.
For Western Mass News, I'm Alyssa McCann.